Hello, my name is Albertina Paciorek. I'm a researcher at the University of Warsaw, and I would like to tell you about our work on vagus nerve stimulation in disorders of consciousness. After brain injury, a person can find themselves in a coma, and upon waking up, somewhere on the spectrum of disorders of consciousness. The categories that you see here correspond to the coma recovery scale. That's the best diagnostic tool that we have at the moment. Disorders of consciousness have been so far treated with some success with brain stimulation. And that's been mostly deep brain stimulation or direct current stimulation. But there's a third new technique that is emerging, and that's stimulating the brain via the vagus nerve. Vagus nerve is the longest and most widespread cranial nerve connecting the brain to all the major internal organs. In the brain, its projection area is nucleus tractus solitarius, which then activates the dorsal raphe and other areas known to control alertness. As such, it is hypothesized that stimulating the vagus nerve might hold promise for people in disorders of consciousness. And indeed, some promising results have been reported by Angela Sergiu's lab in Lyon, where they found some positive effects of vagus nerve stimulation on a single patient 15 years after an accident. What the researchers there used was a surgically implanted stimulator in the neck area. We extend this research with another case study, but this time we use a non-surgical stimulator by TVNS Technologies. It's a device the size of a mobile phone. It has a little earpiece that you attach to your left ear. It's a little electrode, and this way we stimulate the auricular branch of the vagus nerve. In our study, we initially had two patients. We didn't mention the second patient in the poster because Jacob had a very low heart rate, and in the course of the study developed a dangerously low heart rate, so we discontinued. But it's worth mentioning it here because maybe vagus nerve stimulation is not appropriate for all patients. Alice, our main patient, responded very well, and here are her scores on her weekly assessments on the coma recovery scale. We stimulated her for half a year, every day for 4 hours. And you can see the baseline when we started was 4, but she never fell below it. She actually increased, and she peaked at around 12 or 13. This is when we saw some signs of intentional communication and responding meaningfully to yes/no questions. The red color here indicates her scores after the stimulation finished. Our key finding, apart from this behavioral improvement, is a change in her resting state EEG activity. Initially, we hypothesized that we're going to see an increase in her peak oscillations in the theta alpha range. Instead of a rise in frequency, we saw an emergence of a second peak here. And in order to make sense of this data, I need to show you this box plot. And I need to tell you that the peak oscillations in this range correspond to the severity of disorders of consciousness. Here we've got different categories: vegetative state, minimally conscious, emerging conscious, and healthy control. This comes from a study done by Marek Binder and colleagues, where you can see that peak oscillations in healthy controls have been found to range between 8 Hz and 13. In the vegetative state, they are quite widespread, but they are mostly around 6 or 7. And that's indeed what our Alice showed initially. And the second peak that emerged is closer to the healthy controls. We're still trying to make sense of this, but we believe that what we're seeing here is that with the treatment, we're not really restoring the previous brain network dynamics, but the emergence of some other new processes. In the poster, you can also see the power spectra. So just to give you an idea what this analysis looks like, on the x-axis, you can see the frequency and power on the y-axis. And here, during stimulation, around 9 Hz, there's a second peak emerging. Apart from this this improvement, we also saw some physiological promising observations, namely her menstruation returned for the first time since the accident, and also her bowel function improved. So, taken together, we believe that vagus nerve stimulation holds promise for the treatment of disorders of consciousness. And if you'd like to ask us any questions, we would love to hear from you. Thank you very much.